So, these report backs are not a full report back on your whole discussion. What we're going to do is ask each table group to do a really simple, very high-level report, no more than 2 minutes, and we're going to be strict on time. The first part of your report, focus on the most important commitments that table group members will make to participate in the implementation. And of course, that would mean the implementation of what you've just been talking about, okay? So it's really about concrete steps that people are going to take. Secondly, and let's not have the negative outweigh the positive, and that's why we put it second and give a minute and a half to the commitments and not as much time maybe to the challenges, but identify any key gaps or challenges to the implementation of that initiative. It could be there's a partner missing from the discussion, a vital partner that you really need to reach out to. It could be you need further information. It could be you need research. It could be other things. So identify something you need, because we know we're just a group in this one room, and to make Emil's, I don't know, $300 billion cost go away, or to get the benefit of inclusion, if you want to look at it as all the benefits added up, well, that's the work of really all of Canadian society is what it comes down to in the end, so not just in this room. So what we'll do with that introduction, and then what will happen is we'll finish a little bit after 4, and Mary Reid from CASDO and from many, many other connections that many of you have with her, she has been circulating throughout the conference, and she's been trying to figure out how to wrap this up in about a 15-minute time period. Obviously, it's going to be high level. It's meant to inspire you. It's meant to pull everybody together, get us all on the right page. And Mary will be closing the event, and then I'll have some parting remarks, but other than that, we'll be done. So we're aiming to finish by 4:30. I hope not too many people leave before then. Let's really try to stick it out. We're not going to be here till 5 o'clock or anything like that, okay? So we'll start with table 2, and I think it's the most important table to start with, because it's all about nothing about us without us, so you've got 2 minutes.
Hello. So table 2 says persons with disabilities are fully involved and integrated in all activities. We had a great discussion, and to answer concrete steps we are taking, what was identified was starting with ourselves. We're here at this, we're engaged and we are here, but maybe go forth and encourage broader engagement by other groups that were not present, could not attend, or maybe weren't even invited, and even broadening our own understanding and trying to speak up for each other. So also identifying that coverage or intersectionality, we want intersectionality, we don't want tokenism, and so we are commenting that there needs to be a greater and broader representation and engagement at this table or this area plus other places, other events. Now, key gaps or challenges, intersectionality sort of crosses both of those points, but also we had a discussion about financial support to encourage participation and engagement. Okay, and because we note that those who are most privileged can afford to come either through the application scholarship program or through workplaces that allow for it. We also note another challenge is language barriers, and noting that in work environments such as the federal government where official bilingualism is rewarded, ASL, for example, or other sign languages are not recognized. And the last one is trying to get persons with disabilities involved in workplace diversity and inclusion committees, and just as an employer, there might be other ways to engage engage persons with disabilities and try to involve them. So we were brainstorming some of those points.
That's terrific, and we'll just keep going along the same lines, and you can see it's going to add up very fast to very significant things. Table 3, that's the levels of government working together.
So we were talking about the importance of recognizing language and cultural barriers that, particularly around gathering data, recognizing that good data is what will help us identify priorities that cross all of these different levels. That we need to increase conversations across the silos at each of these levels. We also spoke about the need to invest money to make sure that all of the voices are around the table, and particularly we were talking about First Nations communities that would need significant resources to attend. We were recognizing that many issues need to be solved, or at least that implementation needed to start at a municipal level, but recognizing that they weren't necessarily well represented in the room here. As a concrete action step, we identified that there's a federation of municipalities that may have representatives focused on accessibility and thinking about how they could be brought into the conversation. We also wanted to look at existing areas of provincial and municipal collaboration, such as around homelessness strategies, and to learn from other countries where there are go-to websites, for example, around resources, stories, best practices that can be Canada-wide and can cross those levels of engagement.
Really great ideas. The next one, probably we shouldn't applaud each one because we're taking time we don't have, but let's do it anyway. Okay. Employer associations, business labor collaboration.
Hi, so we had a lot of people at our table. Some of them had to leave, but we had a very conducive discussion. So in terms of vision, we need to improve cross-sectoral collaboration by creating industry-based hubs or central committees where everyone has a seat at the table, if they want to, obviously. In terms of our initiatives, we separated into short-term goals, medium-term goals, and long-term goals. In terms of short-term goals, and everyone contributed. So number one, from John from CCRW, is to reach out to various business associations to find out who is not at the table yet and understand their role. And the success will be measured by the level of engagement of those associations and their members. Bonnie from CBSA, working on reducing gap and raising awareness, increase self-identification level, and destigmatize, that's very good, very hard for Francophone, disability. Success will be measured with more self-identification and more realistic data. Okay, and I'll skip the role then. Sama from PIPSC Union to understand more my own bias and suggest training for unconscious biases. Her role will be to organize inclusive events and represent members where an accommodations is needed, and the level of success will be the number of training courses developed, inclusive lens in all we do. Martin and I in federal government create an interdepartmental group to change culture, and the long term is to create one-stop shop for all accessibility programs. Medium-term goals, Marie from Air Canada, liaise with other large national businesses to find out levels of accessibility strategy implementations and share best practices. And Drew from PSAC to transmit work from PSAC to PSAC that was done here for analysis, gap analysis, and need for assistance to get their buy-in. And the only one-term goal was from Melissa from Realize. It's to create awareness between 15 businesses about episodic disability. And the success will be measured when she creates and actually have this network in place in 1 year, and that it's active and useful.
And table 6 is the educational table. I think, there it is.
Hi, so we had educational institutions and partnerships. So what we committed is we committed to create shared responsibility, so understanding that the partners involved, most of us here at the table are service providers, so we can partner with educational institutions and employers, and that will create a community of partnership. And the one thing that we saw, and it wasn't really a gap so much as there's already the school system, and children, when they leave home, the next thing that they go to is into the educational system, and that's already a hub that they're comfortable with, that they feel safe. So really, we're missing an opportunity to be able to partner and use that to help support children with employment opportunities, as well as being able to create an inclusive community at an educational institution. So that's what we had to say.
Table 8 is the partnerships with researchers, the research hub, those sorts of things.
Okay, so we had a discussion after realizing that most of us had spent the day talking about some central hub. So we talked about what could something like that look like. And when we're talking about hub, we're talking about a place where not only could research be shared between different organizations and partners, but also a place where people with disabilities could access resources that they could present to an employer, or an employer could access resources when they're looking to hire someone new and maybe considering a person with a disability. So we talked about how could something like this be designed that's actually user-friendly for all of those people, recognizing that each would have a different need when approaching something like that. So for example, an employer will probably just be looking for a quick fact sheet that describes different things that they can do to support an accessible hiring process or onboarding, whereas a researcher or an academic is probably looking for a very long piece of paper. So taking advantage of technology was something we talked about a little bit in terms of having an equal voice in a governance structure for this kind of hub, making sure that nobody is overrepresented and nobody is underrepresented, and having kind of a commitment to a diverse group of people being involved in this kind of project. Thank you.
The last partnership initiative is the identification of exemplary partnerships and celebrating them. Now, is anyone left from that table? Ah, good.
So one of the things that became very apparent early on is that we really need to define what partnership is. And to start around that defining partnership, it occurs at all levels of our work, right from working with employers all the way up to systemic change and building partnerships around that. So looking at what that is, building a framework that can identify the goal of the partnership and the objectives of the partnerships and how they'll be measured. We identified resources specific around that, which is the identification of information and models to build that framework, and then research support around best practices for measuring the success of partnerships. We also talked about the piece around sharing solid outcomes, or what's the mechanism by which we disseminate information around the work that we're doing in partnership. One of the things that we had talked about is looking at government funding having a requirement to disseminate resources developed within partnerships, or the outcomes get shared in a meaningful way. So there's actually, it doesn't become I own from an intellectual property perspective, but gets flowed back out to the community and all can benefit from. The other last thing that I would say is looking at national meetings or forums where we're coming together and ensuring that there's a mechanism in there to share information, whether it's a poster session, whether it's roundtable discussions, or whether it's what I call speed dating information sharing around programs and successes that are happening out there, and we're not reinventing the wheel because we don't know what each other is doing.
There's such high quality thinking and commitments being made here. It's already really impressive. Now we're getting into the comprehensive reports, table 717, whatever. This is the prevention of poverty, which has been such a big theme.
Thank you. So our vision was that persons with disabilities are not living below the poverty line. And throughout our discussions, it was difficult sometimes to separate what are the avenues that help us reach that goal. And of course, most of us say work and having a good job is the preferred option. But what we know is that that's really not a viable option for a significant group of people with disabilities. So how do we support that group that is really challenged to make that success? So our goals really is to increase income support for people with disabilities, that we lobby for the disability tax credit to be refundable, much like what the Liberal government has done with the Canada Child Benefit over the last couple of years, and that it would be paid out on a monthly basis. That would basically top up whatever other income they would have. And that we would look at really a basic income program as a long-term goal. There's people already working on this. Disability organizations for decades have had this as one of their goals and recommendations going into the government. In terms of intersectionality, there are certainly groups of people that wouldn't fit in terms of this model, partially based on how the disability tax credit right now is designed and administered, so we would need to adjust that or have that as part of the lobby efforts. Partners are many along the line. Tools, we need training and resources for activists, more funding, and the ability to really build stronger links. And we have 4 people who have signed up, who want to continue working on this. And we also have a big welcome for anyone who would like to help us out. Please put your name and email over here before you leave. Thank you.
Next is Table 18, unbundling income benefits, employment supports, and a whole lot of other measures that will help ensure proper support. Oh.
He left. He left.
Okay.
Well, do you want to take a couple minute break to get ready, and we'll do the other tables, and then you come back? How do you want to do it?
No. Is Bill not in the room? No. You want more.
That's it, perfect. Okay, Table 19 is a big discussion item, which is to reform government programs for persons with disabilities. Nobody's there?
No, empty.
You're right, I guess I better look at the table. I know there have been discussions. Weren't there discussions in the other session, Steve and Ron? Yeah.
And that, in a way, they completed their plan.
Okay, so that'll be made available to everyone. Table 21.
Done.
Table 21 is really strongly related to the partnership item that you heard before about educational institutions, but this one's from the point of view of the person with a disability. It's to provide resources supporting the move of young persons with disabilities into adulthood and employment, school to work.
Okay, well, it's schoolwork transitions, so educational institutions should be involved as partners and in this discussion, starting with high school particularly. Also, perhaps groups like the Canadian Apprenticeship Forum would be good to involve. It was felt that it's important to start students in their preparation for the transition early in high school, and the preparation should include equal participation in experiential learning with students without disabilities. Students should be prepared for a world of work that will require lifelong learning and changes in jobs. Students with invisible disabilities need to be prepared for the difficult decision of whether and how to disclose their disabilities. In terms of commitments, it's hard to be specific, but groups like CCRW and the Ontario Disability Employment Network, other service providers, are already doing a lot of this work. A starting point would be just to share the resources. There was really a feeling that good things are being done, but not everywhere, that this has to be part of the school system everywhere. So sharing of resources and a willingness to perhaps participate in a teleconference type of follow-up were the commitments people made.
So, Steve, are you ready? Steve Esty?
As ready as I'll ever be.
Okay, then.
Hi there. I just go by the flip chart notes here. As I say, Bill, I thought was going to report back. Anyway, we spent a lot of time talking about universality of access. We talked a lot about Medicare and how that model of how everybody has access to things, no matter what their level of income was important. We also had a really long discussion about pharmacare and how somebody from the CLC was in our group. We're talking about work around pharmacare and expanding that concept, that pharmacare concept, to include other disability-related supports. The notion about uncoupling this from income testing. So we talked about that, and we talked a lot about the situation in Australia with the National Disability Insurance Scheme. And the whole idea that none of this stuff is income tested, and it all really has to do with the fact that you need to get these supports if you're a person with a disability, just to get up to the same starting line as everyone else. So we talked about that, and kind of the vision was, as I say, universal access. And then we had a short-term and long-term goal, the short-term goal being to ensure the voices of advocacy groups for people with disabilities were at the universal pharmacare table. So again, we talked about that pharmacare issue. And then the longer-term issue, or the longer-term goal, was to expand the pharmacare mandate to include National Disability Support Insurance Program. The partners that we needed for this, aside from the folks here, would be other national disability organizations. The total resources that we needed would be, we need to have resources to expand and improve communications and engage more with organizations of people with disabilities and their caregivers. Here we go. Wow.
Wow. A pretty good recovery, absolutely. So we'll finish off with the 4 tables for business confident workplaces, starting with table 30.
Oh, 20? Table 20.
Oh, what's 20?
Table 20.
Oh my God, Stigma, sorry about that.
Come back to table 20.
Back to table 20. Table 20.
Okay, we had Stigma, and I was just going to say, like for our group, Stigma is really a two-way street. Can you hear me now? That's better?
Get closer.
Okay. Stigma is really a two-way street, and maybe what happens is you have to approach it with love and kindness. I don't want to sound like we're in a bubble or anything, but, you know, some of us old dogs, I'm thinking of myself, we had to fight our way from, like some of us from childhood on, and we've been fighting and fighting all the stigma. So when you get us into the workforce, we have a lot of this, a little bit of something on our shoulder, you know what I mean? So you have to approach us with a little bit of kindness. And then it's the same thing with us. If some of you have disabilities in this group, you know, we have a little bit of stigma facing the able-bodied people. You know, we kind of have that little bit of stigma thinking all the people, all the able-bodied people, you know, they don't like us. They don't like people with disabilities. And that's not true. There's been a lot of people here that's, you know, they really like us and they're on our thing. So I wanted to say that we're for it. We want to work on the initiative.
Hi, I want to add to that, and Ron skillfully facilitated our session and just said, okay, just provide what's your commitment about. And at this conference, I have met with so many people, and as part of unconscious bias and stigma session, I wanted to address my own unconscious biases and hopefully successfully developed personally as well. And also I met with people like John Mudge, who is executive director in WSIB and who is part of an anti-stigma initiative developed also by Steve and many other people. Why don't we know about that? So as my commitment is to continue contributing to the next conference and to Disability and Work in Canada initiative, and if organizations like WSIB or other organizations would like to partner with us and continue building relationships, we are only happy to do that.
Now we'll go to table 30, which is all about the knowledge base of supports to employers.
Like other groups, we also talked about having a hub or a one-stop place for all resources, but that they be curated and specific to perhaps disabilities or sector, and then we quickly recognized that was very complicated and complex, and who would be managing this proverbial hub of resources going forward and keeping it up to date and relevant. Our commitments, we went around the table, so we commit to continuing the conversation, research and knowledge translation, continuing the fight, asking the employer, what do you really need from us so that you can be disability confident? Reflect on internal HR processes and make adjustments. Engaging the employer through meeting them where they're at through that business lens and making the resources accessible to them in a way that they can understand. Continue to commit to policy guidance and continue to have our commitment to consulting with persons with disabilities. We can commit to deepening engagement with perhaps non-traditional partners that we haven't thought of in the past. A commitment to disrupt and have those difficult conversations. And lastly, in our commitment to hold our employers to account, of course, but show them compassion. Many of them are learning about equity, diversity, inclusion, accessibility in the public sphere. This isn't what they signed in their contract, so we need to show compassion for that. And on that theme, and other people have mentioned that too, is perhaps resources are great, but maybe teaching or relearning what it's like to be kind, compassionate, and empathetic in the workplace. And some gaps to achieving these commitments would be the colossal lack of time that we have in organizations nowadays to actually fully engage. The business case is there and everyone accepts it, but how do we move that? And so giving ourselves time to engage and to really truly value what employees with disabilities bring to the enterprise, bring to that work. And that's, I think, what we talked about, so thank you.
Thank you. Table 26 is about benefits of accessible and inclusive design.
Hello. So our table, we started off our conversation brainstorming different examples. There are so many. One that we probably all know is the button that helps us open a door. So this is an example of something designed for someone with disabilities, a permanent one, the stereotype as we've mentioned before, but you'll notice that it's actually convenient for everyone. For example, so someone that's permanently doesn't have their arm, or someone that temporarily broke their arm, or someone in a situation such as holding groceries or their newborn baby. So that's an example. That's an example of like a physical one. And then plain language. I think we all know how fun it is to file our taxes with CRA. Or fill out, we have a CRA guy here, or fill out a form. Even many of us in this room are government employees, and when our parents have to fill out a form, for example, when they're older and they get dumped this 50-page thing and they ask like you in government, oh, do you know how to fill it out? We're like, nope, no idea either. It's really hard. It's just not easy to read, the plain language. So those are just some examples. A gap is definitely education and knowledge, raising awareness. In a study that I read, it showed the two main correlating factors to acceptance is actually exposure and education. So if people were educated more when they're young, or if you had a person with disability, if you're a parent and you have a kid with disabilities in your class, invite them to your home, get your kid to play with them, make them friends, and that person's probably going to grow up and be a lot more accepting and understanding. For measurement, so Fatima here works in accessibility at ESTC, and they have a maturity model for accessibility. So you can rate like 1, 2, 3, 4, 5, and the goal is to go to 3. So that's accessible, and then going up to 5 is fully accessible. So there's ways to measure that as well. It's coming, yeah. It's apparently not developed yet. I think probably my time is over.
So now we're at table 23, case studies of exemplary employers.
So building on what other people have said, and not to repeat the incredible thoughts of other tables that were similar to ours, is when we're looking at this hub, we concentrated and really believed as well that it needs to be targeted for different audience, for the person with a disability who's looking for employment, for the social service agencies so that they can share best practices, as well as then the employer lens. And no one website can have 3 different audience bases. If you have different tabs, if you have different sectors, then you can talk in the language that is important to the audience that you are trying to address. When we looked at already a model on how to go forward, we brought and talked about the Great West Life Mental Health website as an excellent model of how it's actually privately funded, yet great benefits to a corporation where anyone, you don't have to at all use any of the services of Great West Life, and how it also has it streamlined for people who are employees with mental health issues, for supervisors, for accommodation, for HR, how they have videos for each of those different sectors, and as well looking at that. So for us, we recognize that someone, some agency, whether it's CCRW, whether it's a partnership, whether it's this organizing committee, would need to go to the federal government, and if you want to create this hub, you have to create a funding model and then build it and base it upon other great hubs that are being built, like ODEN, as well as the mental health, and look at it that way. And some of the greatest barriers will be, like any wonderful hubs, is who continues to pay for it. The reason why it's worked for Great West Life is because, guess what? They've made a lot of money as a result of offering this, and mental health is a very key thing. But it's only one disability, so how do you create that hub for many others? Thank you.
So we'll finish with table 24, which is supports for persons with disabilities becoming entrepreneurs. And what an amazing array of ideas here and commitments. It's really impressive.
So we're going to network with our entrepreneurs with disabilities and explore funding opportunities, explore interest among our friends from the injured workers to see if they'd like to start a social enterprise. We're going to make sure that entrepreneurs with disabilities are profiled at the Social Enterprise World Forum in 2020, and connect Teamwork Co-op and the former Entrepreneurs with Disabilities Network to any initiative we come up with. And we've noticed there's a lack of entrepreneur with disability champions that we know of, a lack of research on entrepreneurship among disabilities, and a lack of focus around accessibility and disability in terms of entrepreneurship programs.